Hello, good evening everyone. I will be talking to you on Advanced Nurse Practitioner Paving the Way in India. I am Assuma, Dean, Aster MIMS Academy, Kozhikode. First, I would like to tell you a little bit about the history of advanced nursing practice or advanced practice nursing. This is an umbrella term for various nursing types and includes nurses acting in diverse advanced roles. A conception and education of nurse practitioners or advanced practice nurses, as they are later known, emanates from America in 1960s. This evolution of expanded roles for nurses often linked to a perceived shortage of generalist physicians in the USA in 1960s and the market demand for physician substitutes. Nursing history and evolution is strongly tied to the development of the modern hospital. Nurses have a long and distinguished history in public health and home care settings in which they exercise considerable autonomy and professional leadership. Lillian Wald invented the term public health nurse in 1893 to describe a role for nurses that was a combination of health promotion, illness care, and social reform. This was being reported by Bueller Wilkerson in 1993. Thus, foundation for the emergence of nurse practitioners was the legacy of public health nursing. While educational and legal requirements for advanced nursing practice vary across country, there is a global trend to replicate the successful US model. So we will see the definition of advanced practice nurse or advanced nursing practice. Degree program was developed in the middle of 20th century and there is still no uniform definition for the term advanced practice nurse. Harmick in 2014 defines advanced nursing practice as the patient-focused application of an expanded range of competencies to improve health outcomes for patients and populations in a specialized clinical area of the larger discipline of nursing. According to International Council of Nurses 2020, they say that a master's degree is recommended for the entry level of advanced practice nurse. Another definition given by International Council of Nurses, APN can be defined as a registered nurse who has acquired expert knowledge base, complex decision-making skills, and clinical competence for expanded practice, the characteristics of which are shaped by the context or the country in which she or he is credentialed to practice. The advanced practice nurses are nurses who have obtained advanced training and certification, often including a master's degree or a doctorate in nursing in the specified area. Then ANP is an umbrella term that refers to advanced level of nursing practice that maximize the use of in-depth nursing knowledge and skill in meeting the health needs of clients. That means individuals, families, groups, population, or entire communities. This definition has been given by Canadian Nurses Association in 2006. Advanced practice nurse is one of a number of diverse professional paths available for nurses to come up in their career. It has been estimated that close to 40 countries have established or are in the process of developing advanced practice nursing roles. Examples include Canada, United States, Hong Kong, Australia, New Zealand, the United Kingdom, Botswana, Taiwan, Switzerland, Japan, and Spain. In ANP roles titles, there are different role titles for ANPs as nurse practitioner, certified nurse midwife, certified nurse anesthetist, and clinical nurse specialist. However, it is important to note that as well as educational preparation, regulatory requirements, role definition, and scope of practice vary depending on the country. Then these professionals work together with medical professionals to deliver patient care. But there is a vital difference between nurse practitioner and physicians. The duties of nurse practitioners or ANPs revolve around providing patient primary care, whereas the duties of physicians encompass complex patient diagnosis, specialty care, and treatments. Actually, APN or ANP is an expanded role of the nurse. Why this role is evolved? We have to think why this is evolved, because in India also we have to evolve this practice. The rapid and complex changes taking place in health systems worldwide present opportunity for nurses to expand and advance their practice roles to better meet and respond to the needs of the people and systems they serve. Several forces have converged to influence the growing number of and demand for advanced nursing practice roles or advanced practice roles in nursing. The gaps in health service coverage, particularly in rural and remote communities, rising demand for specialized nursing roles, workforce shortages, escalating global burden of diseases, new and emerging infectious diseases, and economic pressures and rising consumer expectations are some of the influences that make this role evolving in every country. India and ANPs. Why we have to think about advanced nurse practice in India? India, under the Indian Nursing Council, had started nurse practitioner program for nurse midwife and has successfully implemented in 8 states. Unfortunately, this program could not be started in all 25 states due to the opposition from medical fraternity. Nurse practitioner in critical care was initiated in the country in the year 2017, but this also could not be materialized in all states. Again, it was opposed to my medical fraternity and also some of the nursing professionals who could not identify the roles of nurse practitioners in our country. Why APN for India again? India is a vast country with different geographical terrains and second populous country of the world, and we belong to low income country as far as economy is concerned. Healthcare delivery to be accessible, affordable and equitable, we need to have adequate people to care for our patients. And preparing a physician to serve rural areas are not viable because they may not come to rural area. They are all concentrated in urban areas. The hilly mountains are not covered by these people, and the people in these areas, remote areas, are not getting adequate medical care. Preparing nurses with post-graduation is much cost effective, and they have strong academic background also. They have learned so many things, and the nurses' knowledge according to the academics is not utilized properly for whatever they are prepared for. The multimodal training provided, the public health curriculum is strong. All these are factors which we need to consider when we think about nurses' expanded roles. Health promotion, healthcare services, and preventive services are already included in the scope of practice of registered nurses or licensed nurses. Already, nurses are prepared and undergraduate level. Nearly 4,000 nursing institutions in the country, catering different states and regions with geographical distributions and high complexity of nursing tasks are taught to this due to the prescriptive curriculum given by the Indian Nursing Council. Then what about the disease burden and the care provided? The increasing number of multi-morbid and chronically ill people in India. The demand for evidence-based nursing interventions. The structural changes such as cross-sector and increased interdisciplinary healthcare. Then nurses with a master's degree who plan, coordinate, carry out, evaluate and conduct research into direct patient care are more in demand than ever before. Then changing population trends, 40% of pediatric population and 20 to 25% of older people. These are the core people of India where they need lot of care, but there are not people to be healthcare people to be provided for caring this population. So nurses who are prepared in the master's level or advanced practice level will be able to cater the healthcare needs of this population which are more vulnerable. And even if you think about forensic nursing as an expanded role, we know that it is very difficult to find out forensic nurses in India, especially when people are coming with medical legal issues. There is not much people in the casualty or emergency room to see these people, report medical legal cases. They have to wait for care. They have to wait for people to come and take care of them. All these are very, very important, which is lacking in our country. Both are not productive. So cost-effective healthcare strategies should be developed, and this can be done with advanced nursing practice, especially with expanded role. APN in India in the context of global development. In India, the scope of nursing has evolved over time with increasing demands for the management of complex healthcare situations at individual, community and system levels. And these demands are aggravated by the specialization of medical practice with advanced treatment plans and patients requiring care in focused areas. The medical professional had become increasingly specialty oriented, and the lack of journalists to provide primary care is very high in India. See, as I have mentioned, the nursing practice, like any other country, is evolving in India too. We have seen that nurses in the earlier period were giving primary care for hospital patients, and also the public health nurses going to the community giving patient care in the home. Like that it was coming up. But in hospitals, we have seen that the hospital scenario has changed. Big corporate hospitals have come, providing health care to people who can afford to pay. And there you will see that the concentration of lot of medical specialists. What about nurses there? Nurses are doing expanded roles, but they are not provided the designation or title of an expanded nurse. We have seen that nurses in corporate hospitals are doing much more than expected or the role prepared, and they were not given the title. For example, we know that nurses are assisting or doing endoscopy in many places. We know that nurses are helping in anesthesia. Nurses are intubating patients in ICUs. All these are there, but they are not provided the title, or they are not provided a license to do that through a registration or a licensure. Or the rules and regulations set up in the country is not permitting them to do legally all this work. So legal permission of this is essential, and nurses should come forward to get this legality for their practice. The qualification and competencies of initial entrance into nursing practice are not adequate to deal with these demands. So they need to be prepared. Special preparation for advanced nurse practitioner is required. Even the MSN program is a generalist program in India. In certain countries like UK, after BSN, they can go for a specialized program and they will not be considered as a generalist. They will be considered as a specialist. Though we have master's program in 5 specialty, how many people are specifically mentioned that they are clinical nurse specialist in this area? For example, I have done pediatrics as my specialty. When I am posted in the faculty role, I know I'm a faculty only. I was asked to take many other topics or many other subjects sometimes. So we are prepared because we are prepared in all areas. Like we are not concentrating on the clinical area, especially if I am a pediatric nurse, I must work with in collaboration with the clinicals of pediatrics and the students coming there to be taught pediatrics. It is not like that in our country. So we have to see that integration of practice and theory should be there, and also these nurses should be titled and designated as advanced nurse practitioner, or after MSc or a doctorate level they should be specified to have a designated title and a licensure for them to work in these areas. So INC proposed nurse practitioners program with additional residency program for 2 years after masters to prepare nurses for practicing at a higher level. That is how the NPCC or nurse practitioner in critical care has evolved in India. What are the hurdles we see? We have seen that nurse practitioner program have been implemented in 2017. What happened to it? Whether all the states in the country could start. We could not do it. Even the government universities were not willing to have this program because of the lobbying of the medical fraternity. And also their political influence also made this issue stay as a big problem for all of us. I myself remember how we went for starting NBCC in Kerala. We had only one university. We have submitted this one for starting NBCC. The Academic Council, Board of Studies, everything has approved the syllabus. It was kept for GC, that is the Governing Council, but it was rejected because now they said that the Cabinet has not passed a legal rule to have this. How nurses will prescribe the drug without licensure for practicing or prescribing drugs. Though INC has said that there should be a standardized protocol, and it was developed by many of the corporate hospitals. Even we went to the Chancellor to start this program, but the lobbying by the medical associations was so high, and the government could not go with this program. Mushrooming of medical colleges in all parts of the country and consider A&B as a threat to medical graduates in the job market of the healthcare industry. This is a big challenge we have to face because a lot of medical colleges have come up. The medical graduates are coming out. They are not getting position to practice. So they don't want nurse practitioner program to be started. And they named nurse practitioner program as a cheap labor program for the corporate management. This is a big threat created by these people, but private universities deemed to be universities and some of the government universities have taken up NBCC program because it is the need of the hour, and the nurses should see that we are coming up in this. While NB roles have been successfully implemented in many settings in most of the countries around the world, the implementation of advanced nursing practice is still in its infancy in India and some of the or many European countries, especially in the German-speaking countries of Europe. The nursing fraternity should have come forward to fight against these forces that create hurdles for their career development. What are the characteristics of nurse practitioner or advanced practice nurse. Educational preparation at advanced level. Educational preparation at advanced level. Formal regulation of educational programs preparing nurse practitioners or advanced nurse practice roles, accredited or approved, formal system of licensure, registration, certification and credentialing. All these should be there to call you as an advanced practice nurse. Then nature of practice. The practice should have integrated research, education, practice and management. All these should be integrated. High degree of professional autonomy and independent practice should be there. They should be capable of case management and to take up own case load. Then they should have advanced assessment, health assessment skill, decision making skills and diagnostic reasoning skills. Recognized advanced clinical competencies, provision of consultant services to healthcare, and they should be capable of plan and implement the patient care. Then the regulatory mechanism. Each country should have their own regulatory mechanism for licensure. Country-specific regulation underpin nurse practitioner or advanced practitioner's practice. This means each country, for USA one type of regulation may be there, in Europe it may be different, UK it may be different. According to each country, they should have their own licensure or regulating mechanism for this. Here, we have to see that there should be right to diagnosis, authority to prescribe medication and treatment, authority to refer clients to other professionals, authority to admit patients to hospital, legislation to confer and protect the title of nurse practitioner or advanced practice nurse, legislation or some other form of regulatory mechanism specific to advanced practice nurses, officially recognized title for nurses working in advanced practice roles. You can see there are so many roles written here. They may be working in different settings also. They will have roles in hospitals, private or family practice offices they can open. Nurse managed primary care centers can be opened. Now in India, wellness center is there. Nurses run wellness center has already started. Then community health centers can be, ambulatory or outpatient care clinic can be started. Mobile clinics can be started. Then in other areas, they can work in Department of Health, long-term care facilities, schools, occupational or industrial health nurses or settings, home healthcare settings, maternity or birthing centers, academic facilities, mental health facilities. To conclude, since nurse practitioner or advanced practice nurses can provide care across the health continuum, spanning from health promotion, illness prevention to curative, rehabilitative and supportive services. They are prepared to provide care to individuals, families, groups and communities across the lifespan. They can practice in a variety of sectors. That means public or private, different geographical locations, as well as any settings. They can practice autonomously or in collaboration with a variety of health and social care providers such as physicians, other nurses, social workers, therapists, if legislation is made in that perspective. Registered nurses' role and scope of practice have been expanded in many countries, and the quality and cost effectiveness of healthcare system have improved. This is very important in the present scenario of escalating cost of healthcare services. While advanced practice nursing is at various stages of development and implementation around the world, literature suggests that this trend will continue well into the future, particularly as more countries embrace this rule. And I hope, along with you, that the future will demand for it and there will be no other choice for the politicians other than recommending advanced practitioners, even with lobbying by associations of medical fraternity. Thank you. Thank you for watching.